Hello, my name is Sophie Beckwith, and I'm talking to you today on a project I'm completing evaluating the cystectomy prehabilitation service at UCLH. Within the National Cancer Plan, there's a focus placed on prehabilitation in patient care before, during, and after treatment. Digital prehabilitation models have demonstrated to improve pre-surgical and post-surgical function following cystectomy. The virtual nature means patient cohorts previously excluded at other centres due to being unable to access resources can be accounted for at UCLH. These studies often look at function immediately post-operatively using patient-reported outcome measures. Our study builds on these by using standardized outcome measures and looks how people are affected a few months after cystectomy as opposed to immediately post-op. Using retrospective, routinely collected data at the UCLH Prehabilitation Service, as well as cystectomy ERA's audit, length of stay data was statistically compared between patients who had received prehabilitation and those who had not. Data was also collected on the following outcome measures: quality of life via EQ5D5L scores, fatigue measured 0 to 10, physical function based on a person's 30-second sit-to-stand result, and nutritional status measured using the PGSGA. This data was recorded at mile 1, a patient's baseline, mile 3 preoperatively, and mile 4 postoperatively. The data was then analysed using a Wilcoxon-signed rank test. The comparison of length of stay data revealed that those who had received prehab on average spent approximately almost 3 days less in hospital than those who had not. Regarding fatigue, improvements were also seen between mile 1 and mile 4 only. Sit-to-stand, PGSGA, and EQ5D5L data demonstrated improvements between mile 1 and mile 3. EQ5D5L data demonstrated improvement between mile 1 and mile 4, showing improved quality of life following prehabilitation and cystectomy in comparison to their baseline. Sit-to-stand data and PGSGA data revealed people functionally improved in their preoperative phase, but had a drop-off post-operatively, highlighting no significant result between mile 1 and mile 4. Overall, however, we can conclude that prehabilitation is an effective way to improve function and patient-reported outcome measures, returning cystectomy patients to their baseline. As the service is virtual and reduces length of stay within hospitals, prehabilitation is reinforced as a sustainable, cost-effective, and successful intervention to improve patients holistically prior to cystectomy. We acknowledge the limitations within the results from selection bias. Incomplete data was excluded. Set inclusion criteria is set for the prehabilitation service. The purely virtual nature of the service and a difference in surgeons who can refer do affect those who are invited to participate. Next steps will be to include an experimental design between prehab and non-prehab groups, assessing results amongst the same milestones and standardized outcome measures to establish if improvements are seen because of prehabilitation or related, in fact, to the surgery, alleviating symptoms amongst the cystectomy population. Thank you for listening.